I'm a family physician. I work at Virginia Garcia Memorial Health Center. I've been there for 12 years. We'll call this family the Martinez family. I've cared for them for 12 years. Mom was a gestational diabetic, meaning that she had diabetes during pregnancy, which put her at higher risk for developing adult onset diabetes later. Her husband had diabetes as well, both very young. I mean, she was in her early 30s and he was maybe 35, and he was probably diagnosed at 30. And I've cared for them over the last 10 years. 3 of their children now have diabetes. One developed at 11 years old, one at 17 years old, and one in her early 20s. And this family, you know, they try and do right by their children. They understand the risks. They can talk the talk. But at any rate, I mean, this is a family that shouldn't be. They have a genetic predisposition, but something in their environment is pushing them towards earlier and earlier onset of diabetes. And they're not an obese family. You know, it's not that you can say, oh, well, it's all about, you know, being overweight and blah, blah, blah. No, they're not. They have a genetic predisposition, and I'm not arguing with that. But something sets those genes in motion, and I think that it is those hormone disruptors. Our messages in our body are getting screwed up, and that leads to the problem. And it also leads to the problem we're unable to detoxify. So I have estrogen in my body, and you know, all women do, and men do to a very small extent as well. But I have to break down the estrogen. And the breakdown of the estrogen comes through a pathway. And if there's more estrogen going into that from synthetic estrogens or from estrogen-like products, like BPA is kind of a mimic of estrogen, my body's spending time breaking that estrogen down, right? So it can't detoxify all the estrogen that it needs to. They get overwhelmed. And so I have more and more free estrogen and free radicals roaming around in my body doing damage. And this is a family that breaks my heart. You know, here is this lovely family, and they've got, you know, 4 more kids yet to develop diabetes. And I can, you know, I count the days. And they are really trying to do everything that they can to influence that. But in the meantime, while I'm educating them about diet and what foods to choose and what exercise to partake in, and then I'm going to give them a list of the, you know, the products that they have to avoid because our government doesn't protect us. I mean, that's ridiculous. Have the government do the role of the protector and say, no, we've seen the evidence. We've got enough evidence. We don't need to have these products in our food system.